The advice and opinions expressed by the host of Autism Live and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice. The Center for Autism and Related Disorders advises working with a board-certified behavior analyst who has experience with autism before starting any intensive behavioral intervention. Any choices you make in determining your child's treatment are completely at your own discretion.
Good morning and welcome to Autism Live. I'm Shannon Penrod and we're webcasting to you live from the Center for Autism and Related Disorders headquarters in Tarzana, California. I'm so excited because it's Wednesday and you know I love Wednesday. In just a few minutes we're going to be joined by Dr. Doreen Granpeesheh, and today we are doing part 2 of the anxiety show. I don't know about you, but I need this today for everything going on in our household. So we're going to be talking more with Dr. Granpeesheh. She'll be able to take some of your questions today, and in just a second we'll fill you in about how you can do that. But before we do anything else, I want to remind you that we're in the last 3 days of the holiday giveaway extravaganza. We've been giving away something every hour that we're live. We'll continue to do that through Friday of this week. And in this hour, we are giving away 3 different sets of IBT training. So let me describe for you what these 3 different sets are. And I personally handpicked these titles because I thought these would be great things to start out the year for your teachers to know and have access to. So package number 1, the first one is Skill Acquisition, Shaping and Chaining in the Classroom, an effective way to teach new skills. Wouldn't you love to give that to your child's teacher this year? And the one that will go with that is Encouraging Success Outside the Classroom, Success During Recess and Break Time. So those 2, you can win that today and gift that to your teacher. Package number 2 is Curriculum and Implementation, Social Skills Training in the Classroom. How many of us would love to have our teacher have access to that? And the companion one for that is Behavior Management, Positive Behavior Supports, Token Economies in the Classroom. Great package. So that's package number 2. And the third one, package number 3, Encouraging Success Outside the Classroom, Emergency Preparedness, to train your teacher to be able to handle any emergency in the classroom. And the companion one for that is Modifying the Classroom for School for Success, Environmental Changes in the Classroom. We're giving away each one of those packages. Anybody can win those. And what you need to do is be watching the show at some time during this hour. Emily will put up a mystery phrase or word on the screen. Write that down, and you're going to want to send that to us by 7 a.m. Pacific time to this address that Emily's going to put up on the screen for you. In the subject line, you'll want to put that you want to win the IBT trainings. In the body of the email, put the word or the phrase. Email that out to us by 7 o'clock tomorrow morning. Of the correct responses, we will pick one winner for each one of those different packages. What a wonderful gift to be able to give your teacher, or if you're a teacher, to get access to knowledge. What a wonderful thing. Those are coming to us from ibehavioraltraining.com. It's the Institute for Behavioral Training. They are remarkable trainings. We talk about them here all the time on the show, and now you can win them. By the way, you should go there and check out their website and see all the other trainings that they have available. They have an amazing holiday package that we're going to be giving away a little bit later on in the week. I don't know if it's tomorrow or Friday, but success for the holidays. They've given it to you in a set of trainings. It's brilliant, brilliant. So you can win those. Also want to remind you that this entire show is meant to be interactive. We encourage you to write in and tell us your thoughts, your questions, suggestions for things that you want to see on the show. And in this next hour with Dr. Doreen Granpeesheh, you can be writing in your questions about anxiety. So Emily's going to cycle through some of the different ways that you can get a hold of us. I'll remind you that if you go to www.autism-live.com, you can watch the live show there, but you can also watch the most recently recorded live show. And there is a white box there. Put your cursor there, type away, hit enter, and there is a slight delay, but it shows up here on my screen, and I can be asking Dr. Doreen Granpeesheh your questions. And you can continue to ask those questions 24 hours a day, 7 days a week. There is no charge, there is no login, no one has your personal information unless you give it to us, in which case we edit it out before we show the audience. It's a great way for you to interact, and we save questions. If you write into us when it's not the live show, we save those questions for a future show. So please participate. We want to help you get access to resources that will help you to create progress. All right, we are going to now take a break and have Dr. Doreen Granpeesheh for Ask Dr. Doreen.
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Welcome to Ask Dr. Doreen. We also welcome Dr. Doreen Granpeesheh. Thank you for being here. We haven't seen you in a couple of weeks between the holiday and you've been away. So thrilled to have you back.
Thank you very much. It's lovely.
And so excited to have you talking about anxiety. I think this is a topic we all need to hear more about, especially this week. So thrilled. And if somebody missed part 1, we're going to recap just briefly. But you did a show a couple of weeks ago, and it is on our server. You can go to our YouTube page and check it out. The Anxiety Show Part 1 for Ask Dr. Doreen. So, and this is a topic that affects a lot of our kids on the autism spectrum.
That's right. And I'm going to just go through today and, try to fit as much as I can in 1 hour. I know that last time we got into a little bit of discussion about different aspects of anxiety and the DSM, and we were not able to really get to the core of it, which is some of the treatments and things that we can do for our kids. So today I'm going to try to go a little bit faster, perhaps, and go over some of the basic details and then talk more about treatment.
Great.
Sounds
go right
good.
Ahead. It sounds wonderful.
And so if I'm going to start, and for those people who did attend and watch the November 27th show, forgive us if it's going to be a little bit of repeat material.
We love a refresher.
Okay.
A refresher's always good.
So we're going to talk about anxiety and OCD, obsessive compulsive disorder, and how they have overlaps or comorbidities with our field of ASD, or autism spectrum disorders. So we're going to talk very briefly about how we can identify anxiety in ourselves, because I sort of want to make sure that the listeners are able to identify what anxiety actually is and some of the symptoms. And if you get good at identifying it in yourself, then it helps you very much to identify in your children, especially our children, because our children, of course, have a very hard time expressing it when they have anxiety. So, and we'll review what is anxiety, what is OCD, and what are some of the signs of anxiety and OCD that we see in ASD and autism. And then I'll throw out some ways that we've used in the past to assess anxiety in our kids, and we'll talk more about treatments then.
Great.
Okay, so we talked about the definition of anxiety, and again, for our viewers, this presentation in its entirety will be up on the Act Today website, the CARD website, the autism-live website, so that people can access it freely.
Absolutely.
And possibly even the video might go up as well, so that people can see this. Okay, so anxiety is really a normal reaction to stress, and it does, a certain level of anxiety is important. If we had no anxiety, nobody would leave their house and you'd just stay in bed and not care about anything, right? So a certain amount of anxiety makes us functional, and so that's kind of important to know. It helps us deal with difficult situations, and often when you look at people who are good high performers on examinations, for instance, those are people who have a mild level of anxiety and not the people who have no anxiety or high anxiety. So just so you know, a mild level of anxiety is a healthy thing. Okay?
Good to know.
Now, when we look at ourselves, the things that we tend to call anxiety, and this was something I just polled a bunch of friends. And I said, when you feel anxious, how do you feel? What are some things? And these are the things they listed out for me, and it might not apply to everyone here, listening, but, here they are. I worry, I'm afraid, I don't sleep, I don't eat, I eat too much, I obsess about things. I have racing thoughts. I have heart palpitations. I have irritable bowel syndrome when I'm anxious. I feel dizzy. So people feel anxiety differently, okay? I think for me, I have racing thoughts and I don't sleep. You know, other people have different levels of anxiety. How do you experience anxiety, Shannon?
I think I have everything on the list except don't eat.
Okay, sadly. Sadly, that's the one you want to have. Yeah. And then if you think about how do I deal with anxiety when you have those symptoms, right? What do you do? And here's again, same group of friends. I distract myself, or I keep myself busy. I talk to my friends. I gain reassurance. I pray. I take medications to help me. I exercise. I breathe. I meditate. I do yoga. I practice positive self-talk. I try to change my beliefs. I avoid what's making me anxious. I take drugs or alcohol or other addictions. I try to change what is causing me anxiety. Okay, so 2 points about this list. Some of these things are adaptive, like, you know, kudos to those people who actually exercise when they have anxiety. What a wonderful thing to do. Or meditate or do yoga. And then some of them are not so adaptive. They're not very, it's not a good idea to drink alcohol when you have anxiety. And the idea here is that people deal with anxiety in different ways. Sometimes if it's overwhelming, you might end up doing something not so good. And if you're able to, I guess if you've dealt with it more in your life and you get better at dealing with it, right? And the second point about this slide is that when you look at these things, you have to realize that our children don't know how to do most of these things. When kids experience anxiety, any child, they don't really know how to cope with it. They don't have these, what we call coping mechanisms. Whether they're good or bad, kids don't know how to do any of these things usually. So they just, you know, go into the previous slide, which is they just continue to worry. They just avoid. They just, you know, they do things that are, they just experience it over and over. They don't know how to reduce the experience of anxiety. And that's important because that takes us to treatment. Right?
And absolutely, and I feel like even already knowing that, it makes me so much more motivated to provide my child with skills to be able to cope.
Exactly.
Because if I didn't have skills to cope, it would escalate.
Exactly.
And I would feel terrible allowing that to happen to my child.
Right. And you know, it's important to just the 2 slides that we went through. What I want our viewers to hear is, you know, you will sometimes see symptoms in your child and you won't relate it to anxiety. So, for instance, let's see, child's not sleeping or not eating or obsessing about things. Now, this is very important. When we see those obsessions, for me, the number one thing is, why does he want things to be a certain way? Why is he all of a sudden now concerned about things being perfect? Those types of things are clear indications of anxiety. And before I start, as I start to try to teach my child not to, you know, line things up or not to insist on things being perfect, I also want to teach him some coping mechanisms.
Absolutely.
So there's 2 sides to it. So this is just kind of like, let's let our viewers think these things through.
Sure.
Okay. Now, as behaviorists, the way that we have to remember, and I'll go back to what the behavioral concept of any behavior is that everything we do is to get something good or avoid something bad. Remember, that's what I always say, right? Feeling anxious is obviously something bad. It's not a good feeling. So sometimes what we do is we avoid all situations that cause anxiety, right? Like examples of this are not wanting to go to school. Maybe some of our kids don't want to go to school because they're anxious in that environment. They don't want to go to a party where there's a ton of noise because the noise level makes them feel anxious because it's too intrusive. They don't really want to go to social situations because they're not good at being social. These are just examples. And if you can't avoid the situation that's making you anxious, then you tend to do things that will help you cope. Some of the things you do to cope are good, and some of the things you do to cope are not so good. They're all coping strategies. Even if you, so let's say something that is good, a good way of coping is let's say they force you to go to, here's a good example. People don't realize the number one thing, public speaking is a huge anxiety-provoking situation for most people. So let's say I force someone who doesn't like public speaking to go into the public speaking situation, and boy, they start showing all symptoms of anxiety. They're nervous, their hands are shaking, they're sweating, all that sort of stuff, but I force them to do it. Now they're going to start to cope. Now some people will cope in a way that's adaptive, so you know, prior to going, they'll practice a lot, they'll breathe, they'll know, you know, they'll start to push their thoughts, their anxiety thoughts away, and so on. Other people will do things that are not adaptive. They'll have a tantrum. They will, you know, refuse or throw things away, you know, around or whatever. They'll put up a fight, you know. So coping mechanisms are good and bad.
Okay.
Okay. With all these coping strategies, what are we trying to gain? When we do coping strategies, we're trying to avoid or reduce anxiety. We're trying to find other things that are rewarding so that they replace the anxiety. That's why we eat, right? Overeat or drink alcohol or whatever. We're trying to reduce the anxiety by replacing it with something else. We try to gain better understanding of what is causing us anxiety, and we want to change our perceptions and beliefs, because anxiety altogether is just something we believe, right? People who go, I mean, there's some people that are very, very comfortable with public speaking. I have no anxiety about public speaking, but other people who find public speaking to be extremely anxiety-provoking. So if one child finds a social situation to be anxiety-provoking and another doesn't, it doesn't mean that our child who's anxious is doing anything wrong. People are different. Their skill set is different. The very, very first time that I spoke in front of 1,000 people, I was pretty anxious, you know, and I rehearsed my talk maybe 20 times. Now I will go and do a talk with absolutely no rehearsal, and, you know, I'll just talk to the audience. So practice or knowing content or knowing what we're doing helps us reduce anxiety. And that is really important when it comes to our kids, because our kids have learned the language recently. They have learned social skills recently. And all of these skills are new to them. So when we force them into situations where we feel they shouldn't really be anxious, we're wrong. They have every right to be anxious. We're asking them, our kids should be anxious every single time they get into a conversation because it's brand new to them.
But that's not a reason to not have them do it.
Oh, absolutely. You just want, you will continue to place them in those situations. But as we go on, and you'll see, there's a lot of things you can do to gradually fade the child in, to give the child other forms of support, to make the situation more palatable so that the child doesn't go to high-level, horrible other coping mechanisms that are not good.
Okay.
We tend to do drastic things when we're placed under a lot of pressure all at once.
Yes.
And if we are gradually exposed to things, then we tend to cope better and have more healthy coping strategies.
Because I sort of see it as the avalanche, that the child has some anxiety, and maybe we don't even realize it's anxiety, but we take them to a birthday party and they have the meltdown because of the anxiety. And then the next time the birthday party comes up, the child is showing reticence, and then we have anxiety about it because we don't want to go through the thing, and so it just becomes this mushroom cloud.
Right, absolutely, very good example. And if in that scenario, if the child had been prepared a little bit more for the event, the whole thing would have been more successful. You know, so it's just a matter of preparing ourselves a little bit better and perhaps reducing the exposure to a gradual exposure. You know, when you have a situation like taking a child to a party and they don't have the skill for it, skill set, or B, the noise level is too high and it's bothering them, or C, they're not allowed to even reduce their own anxiety by eating a lot of the foods because the foods are restricted. So there's a lot of stuff that goes on. When you're doing that, you know, you're flooding. That's a procedure called flooding, and you're basically exposing the child to multiple aversive stimuli all at once. Versus shaping, you know, or a graduated type of, you know, procedure where you're not really placing the child in a horrible situation, you're just gradually increasing. Well, I'll give some examples.
Okay, great.
So, and did I go through this slide? Yes. So if our children with, now this is going on to talk just briefly about how difficult it is for us to even see anxiety in our kids and to identify it. And again, remember there's, I think it might come up in this presentation, but in autism, because it's such a pervasive disorder, people tend to, it overshadows everything else. We've talked in the past about, like, so many of our kids have gastrointestinal issues, and, you know, the doctor will tell them something like, oh, that's just, a lot of kids with autism have GI issues, which means nothing, you know, or, and we just tend to then ignore those issues. And the same thing with anxiety. A lot of our kids have anxiety. That doesn't mean we have to ignore it.
Right.
It's not one of the symptoms of autism. It's one of the side effects of just not having enough communication ability and having too much intrusion and not being able to fit in and so on. So then you feel anxious.
But I think that's why this conversation is so important, because I think a lot of us have felt helpless about our child's anxiety.
Right.
Like, is there something we can do?
Oh,
is there a
totally.
strategy? And that's why I'm so thrilled that you're talking about this.
Absolutely. And that's the thing, you know, when we put it into the bucket of autism, then we feel like, oh, that's pretty scary, right? I'm not just can't deal with this. But it's because the bucket of autism is so just hidden, and like nobody knows how to deal with this huge thing in there, you know?
It's mysterious. It still has this air of mystery.
Exactly.
You know, the doctors act that way, like, well,
oh, nobody knows how to do it.
Yeah, right.
But anxiety is anxiety, and there's been for hundreds of years ways to treat anxiety, and you'll see that some of these treatments will be very effective for our kids.
Okay, well, awesome.
So, you know, if our kids had anxiety, would we even know it? How would they show us? It's very important for us to see this. What ways do they have to cope? And what techniques do they know to calm themselves? And can we help reduce what causes them anxiety to begin with? So it's one thing to say they're anxious, let's teach them coping mechanisms, which we will. But the other thing is, remember, everything, you want to change consequences and antecedents. Can we actually reduce some of the stuff around them so that their anxiety level is low to begin with?
Okay.
So there's many ways to think about it.
Okay.
Our goal is to recognize anxiety in our kids, help them recognize what makes them anxious, because you're not always going to be there.
Right.
So you want your child to be able to realize, okay, I'm going to be anxious. The reason my heart feels this way is that I'm experiencing anxiety. This is what I need to do. Help find good coping strategies. Help them feel confident enough to approach situations that they feel anxious about. Help them overcome their anxiety overall, and then help them find ways to reward themselves, right? Because you want your child to be independently able to push themselves. My son, he gets very anxious about memorizing new academic information, which is really interesting. Like if it's, last time we were practicing French and he was saying, I just can't get this stuff, I have horrible memory, which is fascinating because he's an actor, he loves acting, and he memorizes books of script, books, like literally, you know, way beyond my memory. And what he doesn't realize is memory is memory. Right. It's just that he knows he will be successful memorizing script, but he feels he will fail at memorizing French. You know what I mean? So it's sort of an interesting thing. And the main thing is to teach our kids, okay, this is how I go about coping with this. I'm going to introduce myself to this scenario gradually. Because as long as someone else is pushing you, you're going to have resistance.
Yeah.
So it's important to teach our kids to approach it themselves. We went through this a little bit last time now, this slide, where we talked about in DSM-4, anxiety had, the anxiety disorders were defined this way, and there were, you know, it was panic disorder, separation anxiety, specific phobias or fears, social phobia, obsessive compulsive disorder, post-traumatic stress disorder or PTSD, generalized anxiety. These were all classified in the chapter called anxiety in the previous diagnostic manual. In the new manual, in DSM-5, it's a little bit different. They actually have added a whole section now, and what they've done is for anxiety disorders, they've detailed it a little bit more. So we have separation anxiety, selective mutism, which we talked about, which is sort of kids where you will essentially in certain situations you freeze and you don't speak, you don't talk. Specific phobias, again, social anxiety or social phobia, panic disorder, agoraphobia, which is a very extreme level of anxiety which prevents you start to stay at home and don't want to leave your environment because you only find your own environment to be safe. Generalized anxiety, which is anxiety in more than one situation. Substance or medication-induced anxiety, which essentially means, and this is actually a very good one that they've added, because a lot of medications, like medications for ADHD, will tend to increase the heart palpitations, and sometimes you misunderstand that feeling and consider it to be anxiety. A lot of medications do that, actually. Anxiety disorder due to other medical conditions, like let's say if you are going through chemotherapy or something, you're going to feel pretty anxious because you feel sick, and just feeling nausea. Nausea is one of those feelings that people relate to anxiety a lot. So if other things cause you nausea, you're also going to start feeling anxious. It's funny. And then other specified anxiety and unspecified. So they've just kind of detailed it a little bit more, the anxiety disorders chapter. And they've added another they basically are defining the anxiety disorders as things that are disorders that share excessive fear, okay? And they're clarifying in the new diagnostic manual. We did, I think, talk about this a little bit, where they said that fear is the emotional response to real or perceived imminent threat. It could be real, it could be perceived. And anxiety is the anticipation of that threat, right? So I, in my mind, think that something really bad's going to happen, whether it's real or not, and then I feel anxious, apprehensive about it before it even happens, right? And that's anxiety. Anxiety is usually about real-life events. Not necessarily, but usually. Your perception of the real-life events could be completely wrong. Like a real-life event would be going to school, and your perception of it would be, all kids are going to make fun of me today, right? So your perception might be completely wrong, but it's still a real-life event that could potentially happen.
I like when people say fear stands for false evidence appearing real.
Exactly. Very, very good. That's an excellent way to put it. And there's a huge overlap with OCD, because OCD, now they've put a new chapter called obsessive-compulsive disorders. They've separated it from anxiety because they say that the fear that is in obsessive-compulsive disorders is usually irrational. The only separation then is, okay, so we have, I'm going to school as a very real thing. I might have a sort of a perception of going to school that's a little bit exaggerated, like people will make fun of me, or I might say, oh, today something's going to fall from the sky and hit me in the head and I'm going to die today. And that's a little bit more irrational. And if you go to kind of things that are a little bit more irrational, and it results in you doing irrational behaviors, your behavior might become obsessive-compulsive in nature. And so they're trying to make a distinction between the type of fear that leads to just a generalized anxiety or an anxiety disorder and the type of fear that leads to OCD or obsessive-compulsive disorder. But I don't care. Let's ignore that for a minute, because if you can see on this bullet, there's about 76% of overlap. In other words, if you feel you have anxiety, 76% of the people who have anxiety also develop obsessive-compulsive disorders. 76% of people who have OCD is due to some form of anxiety. Wow. So it's a high overlap. I don't think they should have divided these two. And I think the reason, and as you recall, the DSM-4 did not divide them. They said OCD is a portion of anxiety, and I truly feel it is. The reason they divided it is simply because they would have otherwise had about 20 different disorders under the same heading. So, you know, when we look now at the obsessive compulsive and related disorders, this is the new chapter, they say that these are characterized by the presence of obsessions and or compulsions. So you might have anxiety about something, but not obsess, okay? And so that's sort of a difference. If you are obsessing, then perhaps it has already turned into an OCD, an obsessive compulsive disorder. What are obsessions? Obsessions are recurrent and persistent thoughts, urges, or images in your head that are experienced as intrusive and unwanted. Remember in the very first slides I said that one of my friends had said racing thoughts? That's what obsessions are. Obsessions are racing thoughts. They're like, and then they will make fun of me, and then what will happen? Oh my God, and then that'll be so embarrassing, and I don't know how to handle that, and then the teacher won't stand up for me, and then I'll have to run away, and it'll be horrible. And it's just like, you know, turning things into, it's like a dream state. Right? Often when we push away our obsessive thoughts, they come out as dreams.
I call it going down the rabbit hole.
Yeah,
you just keep falling, exactly, and you keep seeing. It's like Alice in Wonderland. She goes down the rabbit hole, and it just gets worse, and things get big and small, and
exactly. And before you know it, something that was going to school, something that was kind of benign, has now turned into entering a concentration camp.
Right.
It's now turned into something horrible in your mind. And as a result, you tend to become compulsive. Now, this is the compulsive portion of the OCDs, which is compulsions are repetitive behaviors or mental acts that an individual does or feels driven to do in response to the obsession. So, you know, oh my God, they are going to torture me at school, and now I will start to do certain meaningless, in some ways, repetitive behaviors that will keep me safe. So it's one thing if I like put up a tantrum and avoid going there, but it's another thing if I have to make sure that my backpack is green, because having a green backpack will save me, or I have to check and make sure everything is perfect, because if it's not, I'm going to fail. It's going to be disaster. One of my kids, my daughter, when she was really little, was very much a perfectionist, perhaps my fault, in school. And she really wanted, she still is, you know, Nikki, she still is, and she wanted everything to be, she wanted like straight A's, you know. She got a 4.0, by the way, at the first semester, first quarter at college, yeah. And she is just was that way when she was young, and it had to gradually become compulsive in her behaviors, in terms of like the night before an exam she had to go through these specific rote rituals which had really nothing to do with tomorrow at all. And we often do these things. How many people listening here or viewing this don't have a lucky something? Right? You have a lucky rabbit's foot. Where on earth did we get that from? Right. You know, that's a compulsion.
Yeah.
To have something that brings you, that you feel luck, you know, that brings you luck, or those are compulsive types of things. They are irrational. They make no sense whatsoever, yet they are mental acts. They give you some sense of security, right? And we often do a lot of repetitive behaviors, or behaviors as a whole, like the people who have pure OCD washing their hands because they feel that there's germs.
And then and when you bring up repetitive behaviors, of course, this is part of our autism diagnosis.
Which is exactly the slide we're going to look at right now.
Great. Fabulous.
And so, you know, again, I'm trying to help people understand that OCD, or obsessive compulsive disorders, are really anxieties. And now we're going to look at the obsessive compulsive disorders, and I've specifically highlighted in red the ones that I feel we very clearly see in our children in ASD. So these are the ones that are listed under the new chapter, right, under the OCDs. And remember, the OCDs as a whole used to be classified under anxiety, and we've already said they are 76% overlap with anxiety. This is all about anxiety.
Yeah.
The only difference is they tend to turn into coping strategies that are strange, that consist of repetitive behaviors and compulsions.
Okay.
OCD itself, obsessive compulsive disorder. This is you obsess. I think I go into them. So you obsess about a certain situation and then you do compulsions to try to reduce the obsession. Body dysmorphic disorder. We're not going to talk too much about body dysmorphic disorder. This is for people who develop eating disorders, for instance. You're very, very thin, but you still look at yourself and you think you have an obsession about being thin because you think you're fat, and therefore you do repetitive either bulimia or anorexia or other things to make yourself feel better. Hoarding disorder. Hoarders, so people who will gather things and keep them. That's a pure anxiety related thing. Why do we collect things? We collect them because they make us feel safe. You feel protected. You feel like you're never going to lose out in life because now, you know, one day when you need that flashlight, you have 500 of them.
Yeah.
And you hoard so much that you could never even really find the thing anymore, and it becomes kind of just a protective layer of items, materials. And with our kids, you often see hoarding in the beginning phases. Sometimes you'll have a child who even has a hoarding drawer. Like they have a place where they put all their stuff, or they just carry things in both hands, you know, or they have a blanket or they have an animal that they have to take with them. Or, you know, certain things have to be a certain way, like they will insist on wearing certain clothes or not other clothes. And these are all, if you really start paying attention to it, these are forms of OCD. These are compulsive behaviors.
Okay.
Okay. Trichotillomania is the obsessive-compulsive behavior that some people have where you pull out hair. You're anxious and you get into the habit of pulling out your hair. Excoriation disorder is actually kind of interesting, and I've highlighted it here because excoriation is people who have anxiety and they pick their skin, right? So a lot of people pick their skin. You see this in our kids quite a bit, actually. Okay. Some of our kids do this to a very, very extreme level where it becomes very dangerous. Substance or medication-induced OCRD, which is the obsessive-compulsive and related disorders, as I mentioned with our children, there are many medications you take. There's a form of niacin. You take niacin, it's vitamin B. It's not a big deal, but it gives you a rush.
Yeah.
I don't know if it makes your whole head hot for a few seconds. Yeah. And a lot of our kids will experience that as something that is anxiety-provoking.
Okay.
And of course, there's other specified types of this, and then there's body-focused repetitive behavior disorder, which is kind of an interesting one that they've listed here, and it really makes me think of our kids, because it is all of the hand flapping, body rocking, all of these types of things. It's funny, some people in general, when they're anxious, they tend to do things like this. Or, you know, if you really think about it, people, you're anxious and you move your leg a lot, or tap, you know, or like if you just are tapping your hand on the table, those types of things are called body-focused repetitive disorder. And if it gets to a point where it's disruptive, then it can be considered a disorder.
Okay.
I'm going to give a break in a second.
Do you want one now?
No, if it's okay, I want to keep going for a few more minutes, because I really want to fit as much as I can in. Now, some of the commonalities between our OCDs are that some, you know, a lot of them have to do.
I'm going to take your pad. You're fine. You can keep talking, but I'm just going to reconnect your pad.
Okay, great. Thank you. So some of the things have to do with, maybe we should give our audience a, are we back?
It'll be back on in a second.
Oh, there we go. Great,
we go.
Thank you.
I just got a tap. There we go.
So some of the commonalities are like cleaning or, you know, contamination disorders. A lot of people experience that something around me is dirty and therefore I have to clean obsessively. Here's one of the cool ones that they've listed now and I wanted to talk about is symmetry, an obsession with symmetry and repeating ordering. Obsession with symmetry means things have to be a certain way that is symmetrical, perfect. Nobody knows what that really is, but they have to be a certain way. And that is so many of our kids where things have to, and that, notice this has nothing, I'm not reviewing autism, I'm reviewing OCD, I'm reviewing anxiety. And these are symptoms of those disorders. So they're, you know, when you have a child who insists on things being symmetrical in a certain way, that's anxiety. It is an indication that they're feeling anxiety. We're going to skip the other two because they're not important to our current discussion here. But what's important here is genetics. When you look at genetic components of obsessive compulsive disorder, the rate of obsessive disorders, or what's called obsessive compulsive and related disorders amongst first-degree relatives is double the normal population. The rate of obsessive compulsive and related disorders amongst first-degree relatives when the person with obsessive compulsive disorder was diagnosed as a child is 10 times the normal population. So in other words, if you are diagnosed as an adult to have obsessive compulsive behavior, the likelihood that one of your immediate relatives, like your child, would have one is double. The normal population would have obsessive compulsive behavior as well. If you are diagnosed to have obsessive compulsive problems as a child, the likelihood that your child, when you're an adult, will have it is 10 times normal. So there's a huge genetic component.
And what this says to me is that as parents, we have a responsibility to get help for ourselves if we're having anxiety, and that if our children are having anxiety, that we need to get on top of that, or we're going to have grandchildren who have
and you know, it's funny that it's right now, of course, this often happens in, you know, these studies on genetics, they're done with groups of people, and they notice that, oh, if somebody was diagnosed with OCD as a child, they've grown up, and now how many, you know, we're studying adults who were diagnosed when they were kids. But you can also think of it as, is this really genetics, or is it really environmental? If someone has OCD as a child and they're not treated, it's very likely that they go through life with OCD and their kids will have OCD. I had a parent who used to come to the clinic, and she would have a mask over her face and would only come in with a Lysol can, and her child was very, very anxious, and the parent wouldn't let her child go to school because she was afraid that the child would bring germs home and infest the house with germs. I mean, our behaviors really impact our kids' behaviors.
Absolutely.
So this is very, very important to pay attention to.
Should we give you a break?
Let's take a quick break.
All right, we're going to take a break, and we have some questions that have come in, and hopefully we're going to have time to get to some of them. One in particular about helping older kids on the spectrum that are in that transition phase that are experiencing anxiety. So stick with us. We'll be right back after these messages.
Hello, fellow activists. In our last segment, we talked about step number 4, run your own race, don't compare. Your child has their individual journey. Moving on to step number 5, shore up spiritually. Now, spirituality is a very loaded word. It means a lot of different things to a lot of different people. I'm not talking about religion in the traditional sense. I'm talking about a practice, a belief system, or a ritual that speaks to your soul. Now, that doesn't have to be found in a church or a synagogue, although it may well for you. It could be found out in nature. Your altar could be a redwood tree. Your hymns could be birds singing overhead. It's different things to different people. In the early days of Wyatt's autism, I don't know how I could have survived without my church. In addition to dealing with his diagnosis, I was dealing with my husband's battle with cancer, the aging of my parents who lived across the country, and their eventual passing. I knew I could find peace, at least for an hour and a half, sitting in the pew of my church. See, anything can become a spiritual practice if you approach it that way. And for me, it wasn't found in a sermon or in a religious doctrine, but in my fellow man. We'll talk more about that next. In the meantime, find out what speaks to your soul and keep the faith.
Welcome back to Ask Dr. Doreen. We're so thrilled that we have Dr. Doreen Grampachet with us, and she is doing for us the part 2 of the anxiety show, which I think is going to have to go into part 3 eventually. But we should say that you are someone who has been dealing with autism. You're an expert with the field of autism, and I always like to remind everybody that you're a visionary in the field of autism. And so it's so wonderful to have somebody with your expertise taking this for us and putting it in terms that we can begin to understand, so we can start to help ourselves and help our kids.
Right. Well, thank you. I appreciate that. That's very kind of you. But really believe that a lot of our kids and adults experience anxiety, and it's one of the things that really is ignored quite a bit.
Absolutely.
And so what I'm going to do now, because I do have a lot of slides, but a lot of questions that have come in have to do with just the treatment aspect of it. So what I'm going to do is I'm going to just tell you about the next slides, and hopefully you will go in and look at this PowerPoint. And I think, Shannon, what we should do for this talk is at some point I'll schedule with Emily and do more of a 2 or 3 hour long video on just anxiety as a whole. So, you know, the next slide was going to talk about why would individuals with ASD have anxiety. And this is really important because, you know, if you just quickly take a glance at these things, our kids and adults on ASD who have ASD experience a lot of things we don't experience. Like, they don't sleep enough. Most of our kids don't get enough sleep. There's a lot of illness stuff. It's funny because if you go to a restaurant, if you get food poisoning and you have severe GI symptoms, the number one thing people with severe GI symptoms say they have is anxiety. It's an identical feeling when you're throwing up and you have diarrhea and so on. It's an identical feeling to when you have severe anxiety. So there's a huge overlap. And if a child has GI symptoms, they're going to feel anxious all the time. Sensory overload makes us anxious, and our kids, we know, have a lot of sensory overload. Being on medications, receiving treatments, like, you know, if you're going to get a methylene B12 shot every 3 days, you have increased anxiety. You know, I don't know how my kids would handle it if I told them you're going to get a shot every second day or every third day. Just imbalances in our neurotransmitters, which a lot of our kids have imbalances, will cause anxiety. And there's a lot going on with our kids that increases their propensity to have high levels of anxiety. And the ways that they show it are, they do have obsessive-compulsive behaviors, like lining up objects, which they're trying to control their environment. Hoarding, which gives them a sense of safety. Body rocking, which, by the way, body rocking is one that I like to talk about. This motion actually is one of the few motions that activates parasympathetic activity in the brain. So we have sympathetic activity and parasympathetic. Sympathetic is when you are ready for the fight or flight response, and parasympathetic is the calming response. It's your body is reacting to a stressful situation, and your parasympathetic activates in order to calm you down. This body rocking is one thing that you can do that will actually activate your parasympathetic, which is very interesting because our kids do that. It's almost like they're naturally trying to calm themselves. This is why we have rocking chairs. Rocking chairs produce calming effect because of activation of the parasympathetic. So, you know, and signs of anxiety will result in no sleep, in IBD or other GI issues, hives. I will always check our kids. Or in avoidance behaviors, like things like self-isolation or no eye contact, right? Social avoidance or self-stimulatory behaviors, which are all repetitive and rote. I'm not going to talk about the research findings just because actually, the only thing I want to say about this slide, which is amazing, and I'll be very quick, it's just a very spectacular slide. Studies show that individuals with ASD experience greater levels of anxiety than community populations regardless of their age. All other community populations. Individuals with ASD show greater signs of anxiety than individuals within any other clinical group. This is the good one. Individuals with ASD show similar levels of anxiety when compared to individuals with a diagnosis of clinical anxiety. The only other group they're similar to in their level of anxiety is people who have been diagnosed with anxiety. So ASD is definitely one of those that has high levels of anxiety in it. And of course, we talked a little bit about diagnostic overshadowing and reasons why it's very hard to assess. I've listed a few different assessment tools that might help our people identify but you know, I've already also mentioned a bunch of symptoms. If you see those symptoms, assume that it might be anxiety. Now, we're going to start talking, we have about 10-15 minutes to talk a little bit about treatment here. You know, when you talk about it from a behavioral perspective, remember we always want to look at the antecedents and the consequence of things, right? So you can do an FBA, you can do a functional behavior assessment, and you can observe it and find out what's causing the child anxiety. So time for school, Joe tantrums, and then he gets sent home, right? A challenging behavior, like a tantrum, may begin because there's anxiety. So the antecedent, like time for school, is causing anxiety, and then it becomes learned due to the reinforcement. This is a really important thing. Most avoidance is learned. It's something that we imagine. So I want to avoid school because in my head there's something about school that's causing fear, causing anxiety. Now I'm going to do a huge behavior like tantrum, and then they send me home, and great, now I realize that my tantruming behavior worked. Right? So any behavior that has an avoidance function has some level of anxiety in it, is what I'm trying to say. You know, noisy environment, Tom lines up toys, right? And then Tom gets to avoid the environment because he's obsessed with his whole thing. Is it okay sometimes to let Tom avoid the social setting, or is it better to help him cope? And those are the questions. You don't want to reward the avoidance behavior, because ultimately all of our kids have to be exposed to situations that are normal, like going to school. Mm-hmm. But there are many things you can do to help.
Okay.
So there are, first of all, the psychopharmacology treatments, which we don't want to ignore because they're hugely effective. Things like selective serotonin reuptake inhibitors, SSRIs. They're very helpful with this. The SNRIs, or serotonin and norepinephrine reuptake inhibitors. There are many other drugs. Those two are the mildest. Of course, there are others like the benzos are a little bit heavier, but these are medications that have been used for the treatment of anxiety for many, many years. Many years, okay? Mm-hmm. And they will reduce the anxiety feelings. Now, I'm not someone who's one way or another feel very strongly about the use of medications or not, but I will say that research shows that a combination of medication and cognitive behavioral therapy is the most successful.
Okay.
That is the way to go. So if your child has, or if an adult you know has very severe anxieties or obsessive behaviors, start with looking at researching the medications for anxiety, and the two top ones are the most common, SSRIs and SNRIs, and you will see that they're pretty benign. They will just kind of take the edge off. They sort of help you. They modulate your neurotransmitters. I can't go into the biochemistry of it too much today, but they really do help people calm down a little bit.
Okay.
And that kind of helps us then work on other things or teach better, you know, and change behavior better. Keep in mind that there are other medications that help as well. So if your anxiety is coming from having GI symptoms, then take medication for the GI symptoms, you know. So GI meds will calm the GI issues and will help your anxiety as well. If you're having sleep deprivation, get medications that will help your sleep, because lack of sleep leads to significant anxiety. Mm-hmm. I guarantee anyone, go, you know, set your alarm clock so you don't sleep for 2 nights. You'll be the most anxious wreck that exists. And that's a lot of times what happens with our kids. Yes. We don't realize that they're experiencing anxiety simply because they don't sleep. They wake up too often.
Okay, so we have to take care of business, essentially.
Exactly.
If something's going on, we got to take care of that. Otherwise, we're really not going to be as successful taking care of the anxieties we could be otherwise.
Because if you're still not sleeping, I can give you 50 coping mechanisms for your anxiety when it happens, but you're still not sleeping.
Right, right.
Like, let's fix the underlying.
Okay, great.
Then we get to therapy, cognitive behavior therapy. Cognitive behavior therapy's goal is to create new coping mechanisms or new coping templates. And you use behavioral techniques like modeling, exposure, and relaxation. Okay, and we're going to talk about each of those. So exposure, which is the main thing, of course, modeling, you know, that's I don't know if I go into modeling or not, but modeling, you know, most of the time what we're doing is we're modeling bad behavior for our kids, but because we ourselves become anxious.
Yeah.
But if you, like, okay, so an example of this is if a parent has serious anxiety about, let's say, spiders, guaranteed all kids in that family will fear spiders.
Yeah.
So if you are able to overcome some of your own anxieties, then you can model for your children. If a parent goes and touches a spider that's not harmful, children won't be afraid either. We learn from our parents what to fear, or from someone else.
Right.
If we see someone scream and freak out, we will realize, oh my God, there must be something to be anxious about. So don't model anxious behavior.
Okay.
Exposure, this is the most critical treatment, and it will help anyone with anxiety, OCD, any kind of phobia, and it is a heavily used intervention. We use it for so many different things. It's called systematic desensitization. Remember when I said flooding is forcing the person to be exposed to the thing they don't like, just throwing them into the anxiety situation? Systematic desensitization is sort of a way of doing that more gently. There's 3 phases to systematic desensitization. There's exposure to a hierarchy. Essentially what you do is you produce a hierarchy of things that are anxiety provoking. So let's say, you know, I don't know, going to a party is anxiety provoking for an individual, and what you will do, or touching let's look at serious OCD, like touching a particular object is dirty. And that is really, I'm going to avoid that completely. So what I'll do is I will have a list of things that are the highest to the lowest anxiety provoking. So the lowest, I'll use an example that applies to many parents. It's like taking their child to a medical type of intervention, whatever it may be. Child's freaking out, tantruming, throwing fits, and so on. So you sit with you produce a hierarchy for your child that starts with looking at a picture of a doctor's office. Maybe that's even too anxiety provoking. You go to the very lowest and you'll put 20 items in there, 20 pictures or 20 steps. The highest would be actually going to see the doctor or the dentist and actually receiving the injection or
whatever
the procedure.
The thing that has the most fear. That's exactly. At the top of the list.
That's at the top, and the lowest is the least. The second stage of systematic desensitization is teaching your child some form of relaxation exercise. Now this could be anything. It could be breathing. We do a lot of breathing with our kids where you just breathe and count. It could be imagery. So you will teach the child to think of their favorite place, like on the beach, and really do what this is essentially just going in your head and meditating for a while. Or it could be just relaxation.
Or self-talk or all those things.
Lay down, drawing, listening to music. There's many things we can do that are relaxing. Okay. And then the third component is pairing. So what you do is you now do whatever you're good at that relaxes you. You have to really get good at that, though. Okay. So you do that, and you pair it with the first thing on your list. Just look at the picture, and you do your relaxation until the picture is meaningless. Then the next day or 2 days later, you go to the next stage. And let's say the next thing is, okay, a picture of the doctor, or a video maybe. You watch the video of the doctor doing the procedure, and now you are doing your relaxation and you're no longer worried. The third or fourth day, now you're going to maybe even get in the car and drive to the doctor's office, but you're not going up. That's all. You just drive to the doctor's office and you're relaxing, or your child is listening to their music, and now they're much better. The fourth day, fifth day, it might take a month, doesn't matter. And you just gradually work your way up, and you pair each step with the relaxation procedure. So you might have to drive to the doctor's office 5 times and just sit in the car and listen to music, but you do that until the child is no longer anxious.
So essentially we've taught them a coping skill, and then we're gradually letting them try the coping skill out in a way that they can be successful so that we can get it further and further along.
Yes, and you pair the coping skill with the stimulus that's causing anxiety. Yes, exactly. You get what you're doing is you're classically conditioning each level of the anxiety to neutrality, to the relaxation, so it's not going to be anxious anymore.
Okay.
Now, when we do these techniques with our kids with ASD, you use a lot of visual stimuli. Like, I'll give some examples here. A toolbox. So you will teach your adult or child many techniques. One could be breathing. One could be, whenever I feel anxious, I need to listen to music. It helps me. One could be, I like to draw. Drawing calms me down. Whatever they are. And you put them in the child's toolbox. And you help your child pick. The next time they start to get anxious about something, you say, hey, what's in your toolbox? What are your techniques? Pull one out and do it right now. You pick. And you can use visual things to help the child to identify what they have. What are their strategies? You give written schedules. For instance, A lot of times our kids are anxious. This is when parents tell me they hate transitions, right? So write down their entire schedule. Do you know how much anxiety that reduces for our kids just knowing what's coming next? We just take our kids and we do, come on, we gotta go this, and the child's like, good Lord, what's happening to my schedule? What am I doing
And
today?
we would react badly if somebody did that to us.
Oh, everybody,
That's what's
absolutely.
fascinating. I do it all the time, but if somebody did that to me, I would freak out.
Absolutely. And so it's very important for our kids to actually know what's going on. So transitions are important. Narratives. Narratives are things like you will write, like social stories is a narrative. Social stories, for instance, you can just write narratives like, I am the boss. Anxiety is not the boss.
Right.
That's it. Something like that for the child. They can write it down on a small piece of paper, like one of those things in cookies, put it in their pockets. Whenever they're going somewhere, they pull it out and take a quick look at it and put it back. I'm the boss. Anxiety is not the boss. Just something as simple as that. Stories are very helpful, where you can tell stories of someone who was worried about something and then they overcame it. You role play, like just role play the whole thing at home of going to a party or going to school. I mean, it sounds silly, but it really helps our kids. Choice lists, like when you are in an anxious situation, what are your choices? What are the things you can do? It's fine to walk away. That's totally fine. So therefore, what are you worried about? You can walk away from it.
Right.
What are you worried about? If you're at a party alone and you can't get away from the noise, can you go to the bathroom? Maybe it's more. And these are appropriate things. And hey, we do these things. Haven't you ever been, I get anxious because my kids talk to me all at the same time and I've already had 12 hours of work and I'm dying and I haven't slept and there's like a million things, and I'll just literally go in my closet and stand there for 5 minutes just to breathe and calm down.
Yes.
Drawings are very useful to our kids, like thought bubbles, cartoons, like helping we do a lot of cartoon comic strips, where our child will, let's say, throw a fit or a tantrum, and then we'll say, okay, let's talk about why this happened. So this is you, and we'll draw a person, and this is the other person, and how are you feeling? And we'll put some sort of feeling in the bubble next to the heart. Mm-hmm. And what did you do? And then we'll draw something like, oh, so you threw a book, you threw something, or you hit this person. Mm-hmm. And what were you thinking? Oh, you were thinking. And we help our kids identify what they were thinking that led to that level of anxiety and reaction, or avoidance. And then you'll say, what other things could you think? And then you'll try to replace them with some of these more adaptive coping strategies, like, oh, you could think, there is nothing to be afraid of. I can always leave. I'm going to be successful. So reversal of your own negative thoughts,
So really empowering them.
Oh yeah, absolutely. Rule lists of emotions for coping, rules lists of what's normal and what's excessive. Like, keep in mind, none of our kids really know how to do these things.
Yeah.
They don't really know.
They don't have a reference point.
They don't. They really don't. And I'm just going to keep going. I know we're going over a little bit, but I want to get through just maybe this slide.
And I've got a couple
the next
of
slide
questions
is
I
the
want to at
last
least
slide.
touch on.
Absolutely.
Okay.
Now, let me just give some more examples. Like, use concepts that are interesting. For instance, astronauts exploring a new planet, right? That's a really good example, because imagine for our kids, it feels like they're exploring a new planet, right? And if you show them, look at those astronauts and look what they did, and you're exploring, so go and see what's out there and come back and tell me, and that gives them courage. Or there was one child who had a Harrison Ford obsession, was completely, and the way that the strategy was used to just say, what would he do? What would Harrison Ford do? And then whenever we drew comic strips, it was always Star Wars cartoons, right?
Fun.
Or use self-stimulatory behaviors as a way to reward themselves. This is called the Premack principle, where essentially you will allow the individual to, for instance, use line certain things up that don't seem as odd.
Okay.
Like, for instance, how many people have engineers, I love when they have like 10 really sharp pencils in their pocket, or mechanical pencils or something, or when we have like a pencil case and all of them have to be like sharp, or hey, how many people have really, really organized sock drawers or whatever it is. Hey, allow those things because they're adaptive ways of being obsessive.
Right.
Okay, and just don't allow the ones that are not. Like, as I said, organize. Let your child be obsessive in certain arenas, but just not others.
Okay.
I think the last slide is just talking about, you know, like really take care of the anxiety in yourselves, because the more anxious you are, it really does affect our kids as well.
It starts at home.
Yeah.
As always.
And let's see if some of the, I do want to tell our parents about our viewers about one type of therapy called acceptance commitment therapy. I'm pretty sure Evelyn Gould would have talked about this.
Yes.
It's a fabulous intervention. It's a fabulous type of treatment. I really recommend it for a lot of people. It helps you cope with anxiety. It helps you cope with fear. It helps you accept things. I know, you know, maybe next show we can get into, Shannon, how just having your child diagnosed with autism causes a lot of anxiety.
Yeah.
And how we can really help our parents cope with these things. You know, I've put in some of the things, some specific treatments. Actually, what we should do is talk about just ACT in one of. Has Evelyn done that already?
She has, but we can. There's always more to talk about.
Okay.
So absolutely, I want to get to a couple of these questions, and one of them it's going to be seemingly off track, but it's a 911 from a parent who's having anxiety right now because their child is about to go in and get tested for diabetes, and they write in and say, "I know gastric issues are common with ASD kids, but is diabetes common? My son is being tested in 30 minutes again for this, and he is only 4."
Right. I don't know that it's common. I don't have too many kids with diabetes, so it might not be common, but doesn't matter.
It's important to get the test.
It's very important to get the test, and don't worry, don't freak out. It's not a big deal. There are so many children who have diabetes and they handle it and they learn to cope with it and they learn to self-inject, and it's not or check their own blood later on in life. He's 4. I know. I hear your pain. I honestly do. But don't see, this is what I'm saying. This is what happens. We become apprehensive about stuff we imagine.
Right.
You know, maybe it's good for him right now. Maybe later in the future we learn that we all need to watch our insulin levels. Right. Just go with it.
And if it comes back positive, it means that he needs some help, which you would do. So this is a good thing that you're
exactly.
This is
and
a good
it's
thing
so
that you're
important
getting this
to know. Right.
And somebody wants to know, it's sort of that chicken or the egg. Does anxiety cause the stomach issues, or is it the other way around?
Oh, I love the person who wrote that in. That's part of the one of the slides that I had to take out because this is so long. I always think that myself. Which one is causing which?
Yeah.
Very, very good point. And they perpetuate each other, obviously. Absolutely.
Absolutely. So the answer to that is we don't know.
We don't know. We don't know.
And it could be different in different kids, couldn't it?
Absolutely. And you know, when you look at kids with autism, if you think about, and I've said this on the show many, many times before, but if you think of kids with autism as, just put yourself in there. That was my Hong Kong experience. You know, it's kind of like, okay, you have sounds that are too loud, lights that are too intrusive, you're not sleeping well, you have GI issues, you're not comprehending much of what's going on around you.
Right.
Believe me, you will feel anxious.
Yeah. And as you said, that doesn't have anything to do with autism necessarily. That could be any kid, any of us. You're having GI issues, you're going to get anxiety, and if you have anxiety, you're probably going to get GI issues.
Absolutely, that's right. You take any typically developing child, fly them to some other part of the world, make sure they have jet lag, and throw them in a school where they don't know how to communicate with anyone, and culture.
Mess with their diet.
Mess with their diet, and their culture is completely different, and believe me, they'll react just the same.
Okay, next question. Can children outgrow anxiety or separation anxiety? Is it just being a child and feeling small in the world that can trigger it?
Whatever the trigger is, you need to act in order to get them off of separation anxiety. Separation anxiety is often because we give in. Our kids will probably start. So here's how it goes. That's that slide that I said a lot of times this is something that is instigated just naturally. Okay, so of course your child is bonded with mom and dad more than anyone else, or mom and someone, caretakers, guardians, people they feel safe with. And now you're putting them in a school environment where they don't know anyone, so they're going to feel unsafe, which will equate to anxiety. But you have to go back and you have to do a planned intervention. And it's exactly what I said. It's the systematic desensitization. Yeah. Graduated exposure to the school environment with coping strategies will help your child get over it. And if you don't do that, no, there are children who have separation anxiety even at the age of 10. There are adults who have separation anxiety because nobody ever helped them get through it.
Okay, so we shouldn't have an expectation they're just going to work it out on their own.
They might, and the only reason they work it out on their own is because they're flooded, they're thrown into the scenario and they realize they're safe.
But that isn't necessarily the kindest way to do it.
It isn't, and it's not the guaranteed way that they'll get through it.
I sort of feel like we've answered this a little bit, but I want to backtrack a little. Does this apply to kids without autism as well?
Absolutely.
It applies to all of us.
It applies to everyone. We all experience anxiety. It's just a matter of whether we have the ability to cope with it at different levels or not. Okay. And, a lot of people, as I said, remember the first slides, a lot of people deal with it in adaptive ways, not adaptive ways, and, the issue here is to try to teach our kids more useful and adaptive ways to cope.
Okay, this next one comes from, I don't know if you remember, the first time I ever had you on a radio show, the first caller that we got, it's this person who I've become very good friends with.
Wonderful.
But wants to know, they're having lots of problems with OCD-type behaviors. The older her son gets, he's now a teenager, the more pronounced they are, and he's had 5 black eyes self-inflicted in the last 3 months simply out of frustration because his OCD needs aren't being met.
Okay. This is a very severe situation. Here we go. Is he on any medications? Get him on an SSRI medication, first of all, please. That will help take the edge off him immediately. It will really significantly help. Secondly, start from scratch. Allow him to have all of his OCDs for a while. Okay, start with that. That's your baseline. Start working on teaching him some other techniques, relaxation techniques. Does he know how to meditate? There are very, very good tapes out there. I don't know what his functioning level is. Perhaps you know, Shannon, but there are amazing tapes or DVDs or CDs, even online, that you can play that are 5 minutes, 20 minutes, that they will literally take you into a dream state and they calm you absolutely, and they're beautiful, and it's visual imagery. Maybe that doesn't work for him. Maybe music works for him. Get him some headphones that are noise canceling, put them on, and allow him to listen to calming music. Maybe rocking calms him. Teach him something that is calming. When you've identified what that is, do desensitization. Start to talk about the worst thing in his case is his routine not being done, his compulsion not happening. Okay, I don't know what they are. The easiest is one step away from it now. So in other words, let's say he has a compulsive behavior of lining up objects. The worst thing that could happen is he's never allowed to line up objects, or someone disrupts his objects all the time. Just as an example. What if you start with the lowest being, oh, we disrupt the line, but you can form it again immediately. Okay. And you just make the hierarchy all the way up. This hierarchy will differ based on each individual's actual fears and compulsions. Start gradually teaching him how to cope with change.
But wouldn't you say at this point it's important to get some extra help, like you were saying, get some medical help, but also time to get maybe a cognitive behavioral therapist,
Definitely. I mean, if you have a child who's now an adolescent and is giving, self-injuring, he's scared to death. Yes, please get him help. Please get him help. Get him medical help. And get together with a cognitive psychologist.
Okay, great. And our last one, how do we deal with anxiety with adults, not just children on the autism spectrum, young adults that go into transition or higher education and independence sometimes face anxiety with the changes in this transition? We see this as a growing field. As more of our kids get better and they go out into the world, they're having anxiety. Any advice for young adults with autism that experience anxiety with these transitions?
Absolutely. And I'm happy to do another show that just answers questions, but again, ask yourself, what tools do they have? What's their toolbox consist of? What do they have when they go out there? Is it a physical fear or is it a mental fear, right? Do they have books they can read that helps them to calm down? Do they know how to meditate? Do they have all their favorite music? Do they have all friends? Do they know how to connect with you when they need to? What are the tools that you've given them? And just, you know, maybe read the information that I'm sending here on ACT that will actually help you teach them ways to reevaluate. See, what we do with our fears is we tend to label them, and then that becomes scary.
Yeah.
But, you know, there's a lot of different techniques that help you just calm down. If your child or adolescent is leaving, and my daughter just went to college, obviously there's a ton of anxiety involved with it. I think there have been days where I've just finished work and gone straight up to Santa Barbara to spend the weekend with her, or just the week, you know, or a day or two. So you do a graduated thing. She basically doesn't need me anymore right now there, but she did at the beginning of the term. So you observe those and don't panic about them, and you get help.
And somebody wrote in and said, thank you for this amazing information, very helpful, and as a parent I feel that I have some clear ideas on what to do with my 9-year-old.
Wonderful.
So thank you.
I'm very glad.
And we have to let you go now. We have to, because we've kept poor Nancy Alspaugh-Jackson waiting. But I do want to say that the next time that we'll be doing Ask Dr. Doreen is on January 8th. So we'll continue. Sadly. Well, because the next two weeks are holidays. But you'll be able to go back and watch this and the first one. And when we come back on January 8th, we'll be answering questions. So we'll keep questions, and you guys can write in after you've thought some more and tried some of these things and ask some more questions. And
I really want to wish our viewers a wonderful Christmas or any other holiday that you're celebrating right now, and a happy, happy, happy New Year. I'm really looking forward to 2014, and may all of your children continue to do well and flourish, and may 2014 be a peaceful and healthy and just wonderful year for everyone.
Well, we thank you, and I have a small gift for you that's really from all of the parents.
Thank you.
But we won't make you open it here because we've kept so long. But thank you for all that you do from all of us.
Thank you so much.
We appreciate you so much. So we are going to take a break, and then we're going to be back with Let's Talk Autism with Shannon and Nancy. We have a lot to talk about, some of it having to do with anxiety. We're going to specifically talk about how we talk about death of a pet or of a loved one with kids on the autism spectrum, and about talking about autism with kids. When do we do it? Why do we do it? And how do we do it? And we have an amazing guest who's going to be with us for the first time live on the show, Vena Tiero. I always say her name wrong, but Vena is amazing, got 2 boys on the spectrum, and has made a documentary, is now making the second piece to the documentary. So she's going to be here with us, a great show. Wonderful. And more to give away in this next hour, so stick with us. We are here at the Los Angeles Zoo. We've got quite a group here. I've got my son, Jem, Mike from the A Word, and Jack Riley, star of the A Word, and Jessica. We've got a whole crew of people, and we're going to take a tour around the LA Zoo and see some exciting animals. Sound good, you guys?
Who do you have to stay next to? Daddy and Dad.
So remember what we talked about, that every time you do something good, I'm going to write it on my hand. When you get 35 of these, what are you going to get?
3 hours of reading.
Yes, it's not a secret. You can tell people. What kinds of things do you need to do to get a mark on my hand?
Being kind. And good listening. Jem, can you show him where the chimpanzees are? Can you point it out to him?
Show Jack Riley. Tell us what your responsibilities are here at the LA Zoo.
I am the manager of volunteer programs at the Greater Los Angeles Zoo Association. I oversee the docents, the student volunteers, the general volunteers, and community service volunteers.
Give us an overview of what kinds of things people can see at the zoo.
There are lots of animals to see. We have a lot of endangered. We participate in a lot of conservation programs, and we offer a lot of education programs for our community, for school groups, for members, special needs.
What kinds of accommodations can you make when somebody has specific issues?
We have our special needs outreach program, and where we have a van that goes out into the community, and we bring a handful of animals to facilities that can't quite get to the zoo. So that could be a school, that could be a retirement community, that could be a hospital, and there are some courthouses that we visit as well. And we bring a couple animals and we talk about them, and it's kind of a fun experience. So that's our outreach program. And then on grounds, we also have tours, and we offer special needs tours for people catered to their needs. We have our petting zoo, so you can go and you can pet some goats.
We're here with from Autism Live, and we were wondering if you could tell us what it's like to be a goat in the zoo. Really?
And we have our condor rescue zone, so you can go in and pretend you are a condor, or you could be a biologist, or you could be a vet, and it's kind of fun.
Thank you for all the work that you do here and for making it accessible for all of our kids. Here with Janet Jackson. Janet, tell us what your role at the zoo is.
My role is a docent, and we're volunteers.
How did you learn all the things that you know?
Well, that's the great thing about the Los Angeles Zoo. We have a special docent program. It's one of the most stringent ones in the country. Actually, it's UCLA accredited class.
Well, it added so much to our visit to the zoo today, so I thank you for all your knowledge and all your giving to the community.
Well, thank you, because I had a special needs child too, and I think it's so important that they interact with animals, and that helped my son when he was going through so much trauma, that we saw that he was able to grow and to expand a little bit, and it just helped us as parents because we had a tool to use, and we saw the love and the care that he was able to bring out just by touching animals and being around animals, because there is no judgment there.
Amen to that. Well, thank you for paying it forward, because you are. I definitely saw you doing that today. Thank you so much.
Thank you for being here.
What was hard for you guys today at the zoo, do you feel?
To be completely honest, I was about to say this is the easiest, best outing I can recall. My concerns are I think we're sort of past elopement, but it's always on my mind when it's just with the two of us out in a, you can get 20 feet away if it's busy and be lost, be misplaced. But nothing like that happened today. There were a lot of people helping me, of course.
It was interesting for me because Jem hasn't been here since he was 3, like right after we started therapy, and I remember that was hellish, the day that we were here. Sometimes I don't notice the progress until we're out someplace like this. Do you feel like that's true too?
Yes, today I was actually comfortable with him being 15, 20 feet away, and even if he wasn't holding anybody's hand or anything, I was comfortable, and that's a new feeling.
I watched that and I said, man, there's no way we could have done that at that age. So he's doing really well, and I was so engaged by how Jack Riley is so aware of the circumstances around him. He's really doing great.
Yeah, thank you. He's curious. He's and he's just learned a lot. I mean, I can't give enough credit to Miss Jessica. No disrespect to any of our other therapists, and she's been with him for the whole time. So that's a constant in his life, and I dread the day when she's not.
It's always amazing. We had our rock star on our team. There's always one therapist that just becomes a part of your family forever. What would you say to parents who are afraid to do it even with an aide?
I understand your fear, because I've always had it. But sometimes they surprise you. I know it's called a spectrum for a reason, and my son is not like any other son or daughter, and so I can't advise you on what may or may not happen. We were always worried about transitions. They're getting better because we do it, and explain what is expected before you get here. That was a hard lesson for me to learn, but every time I don't explain to him the expectations, I have more problems. I have more transitional issues, but when he knows what transitions he's going to face that day, he handles it. So my advice would be talk it out, but come do it and come again, even if it's a horrible experience, because it might be. You got to do it the first time before you can do it the second time. So.
I think in general, I mean, you know, I explained the expectations here and we carried it out of my hand. I agree with you. It's super duper important. I think it's good for us too, because then we know what we're expecting too.
And they've engaged each other a little bit, which I was very happy to see.
Thank you so much for coming and doing this play date with us. We had a really great time.
Well, thank you for having me. I enjoyed it, and it's just a great experience. I can't wait to tell my wife how well he did. So.
And let's do it again sometime.
Okay, anytime. Okay.
Good morning and welcome to Let's Talk Autism with Shannon and Nancy. We're both just staring.
I had a pause moment.
We were late today because Dr. Doreen was talking about anxiety in our children. Well, clearly this is what they used to call in television a hot button topic, a water cooler topic.
Yeah, absolutely. So
everybody
went over.
Yes, and I was sitting out in our control room with Emily, our director, just kind of glued, because my biggest issue with Wyatt right now is OCD and anxiety, which is manifested in a physical stem of splashing water. And so he's constantly searching for bathrooms wherever we go where he can splash in the sink. He's always at the sink. If there's a pool at a house, hallelujah.
Well, and we had OCD week because I think I shared on the show that my purse got stolen and Jem was with me when it happened, and it raised all of my OCD and all of Jem's, and he has been doing some very repetitive
But I want to praise you about something.
Oh dear.
Last week we talked about what would Mother Teresa do.
Yes.
I read a blog or something from my newsletter to urge us all to think about what would Mother Teresa write, was what I was saying, but do. And you,
I listened to you, and so I put it on Facebook. I said, I'm praying for the person who stole my purse, and I put it out there. Now I will say that a couple of times it's made me uncomfortable, and I've had to go through things that weren't fun. I've gone, but. You know,
who doesn't?
Well, you know, I'm human.
But like you said, they are obviously in worse shape than I am. And you know
no
what?
doubt about it.
That's really some wisdom on your part, and not taking on that anxiety, that hatred, because that only adds fuel to the fire, right?
Yes, absolutely. Okay. So, and thank you for putting that in my head. I have to, before we go any further, we have giveaways every hour.
Let's go.
And in this hour, we're giving away we're giving away packages of different things. So we have here these fabulous books written by Grady P. Brown, who's on the spectrum, and it's a companion piece. Okay, so
Shannon's got to check her mic. So Nancy.
And so, in any case, these. So we're giving away these two books, and I have two sets of these to give away. And Grady is on the spectrum, and these are wonderful sci-fi books that he has written. He was here on the show.
Okay. Yes, he's
and
very brilliant
autographed these.
Yeah. Great for a teenager.
Absolutely. We're also giving away some of these. Mike Hipple, who has been a wonderful guest on our show and a wonderful daily viewer who contributes on a regular basis. This is a really important children's book that he has written, and we're going to be giving away a couple of copies of this during this hour about using assistive technology and the importance of putting that in our kids' hands. And this is great for any child that is having some issues at school and feeling a little bit different.
Yes.
Mike is...
Maybe your child's nonverbal, they need an iPad. You know, we had our Christmas concert at Wyatt's school, and we have several children on the spectrum at that school, and a little girl had her iPad, you know, singing with the choir, and, you know, I was actually wondering, wow, you know, that's really cool the way the children support her, but I'm sure that for the child, they're like, why do I have to have this? Right?
Yeah, and this is a great, great book that Mike has written. Mike has firsthand knowledge. This is a lovely drawing of Mike, who toodles around in a lovely chair and has his assisted technology and does amazing things. And Mike is studying to be a therapist. He wants to work with kids on the autism spectrum. Cool. So this is an amazing thing. We also, this is like the book parade today. We've got autographed copies of Unintentional Humor. Have you seen this? This is so much fun. Lovely cartoons of taking phrases and showing us what it looks like in the mind of somebody. Of somebody.
My son is thinking, okay, here's your ring.
Yeah, here's your ring. And then we also have some lovely Kids Bop toothbrushes. Okay. We're always trying to get our kids to brush a little bit longer, and these play a song. These play a song to let them know if they brush long enough. They have different songs on them. This one has Good Feeling, and this one has Party in the USA.
Love it.
So wonderful stocking stuffers. So all of this, make sure you're watching during this hour. When you see the word or the phrase on the screen, email us to this address in the subject title. We're going to put together a package here of a bunch of different things, but if there's something specific that you want, or you can just say package for this one, but then in the body of the email, put the word or the phrase that Emily shows on the mystery word or phrase on the screen. Okay, we've taken care of business now, but we need to go back a couple of steps and talk about the fact that Nancy was not with us last week at the very last minute.
Yes.
And we mentioned that you were having a family issue, because that's really what it was.
Well, what happened on Tuesday, let me backtrack, because on Tuesday, and if you have children at home, we are going to be talking about the loss of beloved pets and potentially family members, well, grandparents in specific for our children. So I just want to tell you, it might not be appropriate, because you might want to be the person that handles talking to them about this if they're watching by any reason.
Good point.
So last week we had readied ourselves for the putting down, as they say, our 18-year-old Jack Russell baby girl, BG, who my son, there she is.
Oh. Such a sweetheart.
Yeah, she was 18, believe it or not.
Yeah.
And that's at the vet after she's been given her tranquilizer. But we had quite a build up to this, because we know Wyatt is so attached to her. Now, we did not talk about it because we talked to his behavior therapy team, and they said, do not bring it up too much in advance, because that will cause anxiety.
There we go.
But
that's the magic word.
Take opportunities to explain why she's, maybe she's blind now or she's deaf now. Now, one of the things I learned was not to just say she's old, she's old, she's old. That caused him anxiety about getting older.
Yeah.
He kept saying,
Of course it would.
Hello.
Yeah.
And then I realized it when he said, Mommy, I don't want to get old. I don't want to go to 8th grade. I don't want to go to college. I mean, it started becoming, because he was associating the death of his grandfather a year ago, and the death of a year and a half ago, and the death of his grandmother 2 years ago, with getting old.
Yeah.
So in his mind, old, death.
Of course.
So I started shifting it to, she's sick.
Yeah.
And very sick.
Yeah.
And we'll have to see what the vet says. So we picked the date. We did not tell him she was not going to be there when he came home.
Right.
He went off to school. When he came home, he came running in. Where's BG? Is she still at the vet? And I said the vet decided it was time for BG to not be in pain anymore. And in our house, we use heaven. But, that's very personal choice.
Sure.
And I said heaven is where she doesn't hurt anymore.
Yeah.
But her spirit will always be with us. And so he was okay with that. Now, what he likes to do, because when we lost another dog, he wants to get a replacement dog. Well, we can't have that in our house right now.
Right.
And so we said, we're not getting a new BG, but we took the opportunity to have the therapist that was there that day. We were very lucky to have a behavior therapist that afternoon. Explain to him that we have 2 other dogs, we're big animal people, and that the youngest of the dogs, who was a rescue, was going to especially need his help now.
Very good.
So they immediately went out for a walk.
Right.
And every time Wyatt would get back on BG and start perseverating, because he's a perseverator. Mommy, is BG coming home? Is BG in heaven? Mommy, is BG coming home? That's what I anticipated.
Right.
We didn't have it. And I think it's because we set up, we did not dwell on it ourselves. We had a behavior plan in place.
Yeah.
And I really believe this is necessary when you're dealing with this sort of massive shift.
Yeah.
Okay, fast forward one day.
You said massive shift, but for a second I heard something else.
Okay, sorry.
No, it was what I heard.
But
No.
that too.
You said shift, but I heard other things.
Okay, that too.
Sorry.
So, that too. If you get my drift.
Yes, I do.
So,
I do.
The next day, I go to his mommy's breakfast at school. I get a call, like 20 calls. The vet, my boarder at our barn, said my horse was down. This is a horse that I have owned for 18 years. Had such a special, will you show a picture, Emily, of, that's when Wyatt was born. Okay, that's the relationship. So let me just say, we have pets in our lives and we have soulmates pets. Soulmate,
But
right
that's
there.
why I say it was a family issue.
Yes. And so, let it suffice to say, the vet came. He was what's called colic. We don't need to get into that. #1 cause of death in horses when their intestines flip. And so I spent the day with him on painkillers, on his head on my shoulder, and the vet came back at 5 o'clock, and he said, he's not done as well as I hoped. And I said, please tell me, is he going to make it? And he said, I would say more likely not. I did go to bed, and I gave him a painkiller right before bed, and then at 5 a.m., I must have felt he had gone. I threw my boots on, ran out, and I'm very thankful why it was not there at that point, because it allowed me to have my grief, which was throwing myself on top of him and hugging him, and I woke up my husband with my screams and cries. And
you keened.
I keened.
I'm Irish. That's what we call it.
I keened.
It's necessary.
And they picked me up. I knew I had to get up. I mean, you know, but for a while I wanted to just be there and just, you know, go away. And then, you know, my husband was a saint, but it's so funny because I didn't say anything to Wyatt that day, but he knew something was wrong. He came home. He saw my eyes. He saw. And the next day, I chose to tell him that Addie was not, because I was afraid if he went out back and saw that he was gone. I said, Addie has gone. He's gone to where there's more room. And he looked at me and he said, Mommy, Addie died. Bless his heart, he knew the truth, and what I was trying to couch for him, he just said it and accepted it. So obviously he wasn't as bonded. So that was pets for me, and that was fresh last week. But on an even bigger level, and I'd like you to talk about, you lost your mother a year ago. And I know this is hard for you. So if you need me to talk,
it is hard for me this week.
I know.
You know, it's, I think,
I'm going to interview you now, so you don't have to carry it. But with Jem in particular, because that's what we do, we share our experiences about parenting children with autism, the good, the bad, the ugly, the beautiful, the heart-wrenching.
And he has done remarkably well. You know, it's been interesting because we didn't ever go with him to my mother's house before she was sick because we were so busy with autism. She would come to us. Because we couldn't, she lived in Iowa and we couldn't very well, you know, take the whole therapy team and get on a plane and go there. So she would come to us. And Jem always used to say, it's not Christmas till Grandma's here.
Yeah, that's...
So, and we lost her right before Christmas last year. It's just a year now. But I was so proud of him, the way he dealt so well. He takes it all in stride. You know, we have seen anxiety. We have seen things come out in different ways throughout the year as we've gone back and dealt with some of Grandma's stuff. And when we went this summer, she left him a piano. And she talked to him about it. She knew that she was ill and that she probably wasn't going to live much longer. And she called him and said, I want to give you my piano. I know that you are, you know, a musician, and I want to give you my piano. And he was thrilled with that. But it became an issue, right? About how are we going to get this piano from Iowa to California? So when we went in June to get the piano, we got stuck in a tornado and had to take shelter in the basement of a store very suddenly, and it was very terrifying. And he said to me then, he had dealt so well up until that moment, and it's funny when, you know, it's like the matchsticks on the camel's back and then it all kind of collapses. That was the moment for him, that we got into the basement of the store and he looked at me and he started to cry and he said, I never want to come to Iowa again. Bad things happen in Iowa. And, you know, interesting how you link up, you know, different things and what he linked up. And I said, oh, sweetie, you know, it's not Iowa.
Wyatt doesn't want to go back to Virginia and North Carolina because that's where Papa and Grandmama were. And he doesn't want to go back there, he says.
Well, you know, and we can all understand that, right? But, you know, so here I am, we're drenched because we had to run through a parking lot as sirens were blaring. My heart is beating because I didn't know what was going to happen. And we took shelter in this store and we're pressed in with like 100 other strangers as the sirens are going and we're hearing the noises and wondering whether the top of the store is going to go off. And this is the moment in which my child decides to deal with the fact that Grandma has died, and you know, and I got enough going on. But he, you know, we talked. We were stuck between the rice and the cookies in the shelves of the store, and we talked about, you know, that she's and we'd talked before about that she's always with us. But I have to say, he is doing much better with it through this season than I am. And even last night, he was saying to me, Mom, are you okay?
Yeah.
And I said, just missing
But once
Grandma.
again, as Dr. Doreen said, our children pick up on our stress, our sadness, very much.
Absolutely. He
so
knows.
they know what's going. They know.
Totally.
They may not be able to express it, but they know when Mom, in particular, is not right.
Yeah, and he, he picked on it up on it before my husband did, and was rubbing my back and saying, "Are you okay?" And I said, "Yeah." And I said, this is part of life, that you miss people, and it's okay to miss people.
It's okay to miss people. This is a huge lesson. Has been for Wyatt. I imagine other kids on the spectrum. I mean, he gets attached, and then when that person moves on, he cannot move on. It's part of that need for routine. So I also want to mention that for us, because I know Vena's here, social stories have been hugely helpful in a couple of different incidences. One in particular has been when Wyatt used to elope and wander and safety. We've done a lot of social stories on safety, and then he ended up writing a book called Sammy Learns to Listen about a little monkey who gets lost at the zoo. And because he didn't listen, he has to spend the night in the zoo. He gets locked in. So that was hugely important for him. We have also done social stories on he's very bothered by children that don't have things. It makes him very sad. And he read a book once called Those Shoes, where the little boy couldn't afford shoes, and the grandmama was with the little boy, and he's like, where's the mom and the dad? And I'm like, I don't think this boy has a mom and a dad. He became obsessed with that. And I would catch him, bless his heart, drawing pictures of like a ranch house like ours with a pool in the back and stables, no less. We live in an old ranch house with stables out back. And 4 dogs and horses and drawing. And he goes, now Jeremy has things. I want Jeremy to have things. But it was a way that he worked through it. And sometimes books and social stories can really be helpful. And if you've got a nonverbal child that can't talk it out, give them a way to, in drawing, I mean, I'm not the therapist, but I think these are tools.
Absolutely. And for Jem, we did some social stories, but I will tell you what works better for us is if we watch a movie in which something similar happens. It gives him a reference.
Sure. Social stories are probably for younger children, but if you've got really young children at home, I think they can really be helpful.
Absolutely.
Need to process.
Yes, giving them a way to process and the freedom to have the feelings. That's the other thing, the freedom to have the feelings. And showing, and I try to show my son that I'm having feelings and that it's not, I'm not going to die from having a feeling. You're not going to die from crying, and it's okay to go in your room and cry. Okay to be sad. It's better than having a tantrum. Yes, it's okay to be sad, and it's okay to be frustrated, and all those things. Wyatt's asked me all the time, Mommy, what's frustrated again? He wants that exact definition. But let's take a break and get Vena in here. Yes, let's absolutely do that.
She's one of my, love this woman.
Absolutely, incredible woman. A mom of 2 sons on the autism spectrum, and a great filmmaker, and we want to talk about the new film that she's trying to make. All right, so stick with us.
We'll be back.
So the holidays are fast approaching, and you might be looking for a fun cookie recipe you can make with your kids. Well, thankfully, Breads from Anna has given us a great sugar cookie recipe that we can make that's gluten-free. So let's get started. Here's some of the things you'll need. For the dough, you'll need 1½ cups of vegetable shortening, 2 cups of sugar, 2 tablespoons vanilla extract, 1 tablespoon almond extract, 4 eggs, 3 cups of Breads from Anna dairy-free flour, 2 cups potato starch, 2 teaspoons baking powder, and 1 teaspoon of salt. And for the icing, you'll need 1/2 cup of shortening, 1/2 cup of butter, 1 tablespoon vanilla, 4 cups confectioner's sugar, and 2 tablespoons of almond milk. To start with, we're going to just mix together our liquids. So we've got our shortening, eggs, our vanilla, and our almond. And we're just going to go ahead and cream these together. So once that's all creamed, we're going to go ahead and add our dry ingredients, starting with our Breads from Anna flour. And we've got our potato starch, and we've got our baking powder and salt. We're also going to go ahead and put in 2 cups of sugar. All right, once that's all blended together, we're going to go ahead and cover this and chill for about an hour or overnight in your fridge. So it's been an hour, our dough should be cool. So we're gonna try to roll this out to about a 1/2 inch to about 3/4 inch in thickness. So while I'm rolling out the dough, I preheated the oven to 400 degrees. And I have a baking stone preheating in the oven that I'm gonna set these on. But if you don't have a baking stone, that's okay. You can just use a cookie sheet with parchment paper. Now you're gonna take your cutter and just cut out all your cookies. All right, so I'm gathering my cookies, my little dudes here. That's good. Let's go ahead and put these in the oven. And these should be good to go in about 6 minutes. So while our cookies are baking, we can go ahead and start making the frosting that we're gonna use once they're done. So we're gonna need our shortening. We're gonna go ahead and add our butter. We're gonna add our vanilla. We're gonna start to blend this. Okay, so once we cream these together, we're gonna go ahead and add our sugar just a bit at a time. And last but not least, we're gonna add our almond milk just to soften it up a little bit. All right, that looks pretty good. So once our cookies are done baking and we've given them time to cool, we can go ahead and frost them all. Okay, so our cookies are ready. Let's go get them. These look pretty good. Now's the part where you get to be creative with your kids. Feel free to ice these in different colors, with sprinkles, however you want. We've got our cool cookies here, our homemade icing. All right, these look great. For more of these recipes and to possibly win some of your own breads from Anna, go to our Facebook page at facebook.com/autism-live, and we'll see you there soon. Thanks for joining me.
Welcome back to Let's Talk Autism with Shannon and Nancy, and we are here with a guest, a special guest, and a dear friend, Dana Thiero. Am I saying it right?
Yes, you always say it right. That's wonderful.
And Dana, we're going to talk about, we've known you and your filmmaking skills. You're the mother of 2 boys on the spectrum. But today you've got an exciting new project to tell us about.
Yes, my second film in the 5-part My Thiero Boys documentary series is almost finished. And it's titled My Thiero Boys Believing in Miracles in Spite of Autism.
I love that title, and I know you do, and you have performed miracles. And so tell us about the focus of this second part.
Well, the first part was a general introduction, you know, diagnosis, treatment, education, aggression, things that we deal with, and a little intro to what we're going to do in the future. And you so awesomely set us up for that with your soundbite, and I'm just so grateful that you have a strong presence in the first film.
Well, thank you. How can people support this one? How can people support the second?
This film is getting us ready for the future. Okay. So I have a crowdfunding campaign. We have 15 days left. Go to Indiegogo.com, everybody out there, and donate as little as you like from your heart.
Indiegogo.com,
and then type in My Thiero Boys.
Okay.
And you can donate as much as $10,000 even. But
if you're Santa Claus out there, and you want to help this woman tell her story, which needs to be told, it is inspiring, miraculous, heartbreaking, everything else.
And my story is your story.
Yes.
It's everyone's story. And with 1 in 50 children born with autism diagnosed per year, we need a plan. Because in 10 years, 20 years, 40 years, when they become 30, 50, and 70, it could potentially cripple our society. So this film will set forth a plan. Ideas that have been worked on by senators. We have Senator Curran Price, Senator Daryl Steinberg. We have Matt Asner with Autism Speaks, the Southern California Executive Director, and Holly Mitchell, who's now moving into a senator position, who worked on
I didn't realize Holly Mitchell is moving into a senator position.
Yes.
That's excellent.
Yes, well, she's worked with President Obama, so these people have already been on the ground, forging the future.
And I know Ariva Martin is a part of this.
Ariva Martin is still a part of it, and Dr. Bob Sears will be in this next film.
Great.
So these are things that people who are doing work now are planning for the future. But autism will affect everyone.
It will. And we, you're preaching to the choir, girlfriend, because we have been saying this time and time again, how we have to mobilize our community. And I just want to ask you, why do you think the president and the federal government are not hearing the voices out in the country? What do you think's going on? Do you have any ideas about that? I'm just curious from your perspective.
My instincts say they're inundated with other issues that have been looming large, and we have, quite honestly, the whole, for lack of a better term, issues between the parties.
Yes. Right. The bipartisanship.
Yes. Absolutely.
Yes.
And somehow the posture of one party just hasn't helped everything move forward in a way that it could have. And that's sad. And I pray for our government. I pray for our public officials, because I don't know if they really know how it affects us here.
Yeah. And that's what Mother Teresa would do. Mother Teresa would pray for them and hope for them to see what all of these families, what all of our families are going through.
Absolutely. But we are getting to the point where it's almost time to march. There have been people filling up that Washington, D.C. There have been, big marches for all types of causes.
Yes.
It's time for us to make our presence known. I watch rallies in Sacramento that are phenomenal, that make change in California.
We've been at them together.
Yes, and they do not make the LA Times.
No, they don't.
They do not make LA local news. They do not make national news, but national change occurs from those rallies. Why is that?
Well, part of the issue, too, is so many of our warrior parents are dealing with their children.
Yes.
And they're so overwhelmed. Anytime you have a crisis like this, you've got the people that are overwhelmed with dealing with it, right? I mean, when you're in that position, as the three of us have been, and you're... Shannon once told me to back up on a sentence because I said, I just don't know why it's all falling apart. I mean, before our lives were decimated by cancer and autism.
Right.
And she goes, stop, back up. And what did you say? I said, well, before our lives were decimated by autism and cancer. And she goes, that's exactly what happened. Don't you understand that?
Yeah.
And I'm like, oh, wow. And so many, and I wasn't decimated to the degree, I mean, at Autism Care and Treatment Today, what we do.
Yes.
We deal with the families that are decimated.
In a wonderful way.
Well, thank you. But we know that reality, and let me tell you, it is everywhere out there. We are talking, like you, single parents who had to do this on their own.
Yes.
Which I want to say, you had a particularly tough battle. Can you tell us a little bit about how, you really rose up from...
You're a powerful woman.
Can you tell us a little bit about
your story?
Gosh, thank you so much. Yeah, well, just when our marriage dissolved, I was working in network news.
Right.
And it's very difficult. The hours are long, as you know.
I was as well in television.
And so I had 2 nannies. I had to just let all of that go. I pulled myself out of the workforce to focus on the boys and just exhausted my 401k and just made it happen and really understood what they needed and watched them
Did we put
develop.
a picture up of Vanna and the boys?
Yeah.
I know we have. Are they gorgeous?
Beautiful.
That's Carter on the far left and Bakari on the right, and both boys with Dana in the middle.
Those pictures were taken just this past Sunday.
You have the most gorgeous family.
Oh, I love my kids.
Beautiful.
I love them so much.
I know you do.
So we were able to connect, and we got ABA in-home therapy, which changed to adaptive skills. We really piled in the speech and the OT.
But meanwhile, you went into a 1-bedroom apartment.
Absolutely, and suffered great depression, and came up and out of it a documentary filmmaker.
Yeah, I was going to say, but one of the things you did while you were in that 1-bedroom apartment was you picked up your camera and you documented what was happening as a gift to yourself, as a gift to your boys, and as a gift to all of us.
Thank you for seeing it that way. Thank you.
What you did with that little camera, many filmmakers cannot achieve with multi-million-dollar budgets. I just want to say that. You moved us.
Absolutely.
And the authenticity, that's a big word these days, big buzzword, authenticity. You have it.
And I want to encourage
people, not just the pretty. Yeah, I really want to encourage people to go to this Indiegogo.com and type my Thiero, Thiero, boys documentary, learn more about it, and make a donation. Make a donation in somebody's name, in your child's name, for Christmas, so people can hear the kind of struggle that is going on out there firsthand, first person, that this woman has gone through with 2 boys on the spectrum, virtually no financial support, nothing, decimated, we're talking.
How can people, is there a way that they can see the first installment so that they can see what it is that you're trying to do? Is it available yet for people to see?
It will never be available in that way.
Okay.
It is free in screenings. I'm encouraging families in autism support groups, parent support groups, all over the country, all over the world, to contact me and arrange a screening.
Okay.
30 people. You know,
wonderful.
30 people to 100 people.
And so worth it. The conversation that will ensue from watching the film.
Yes.
Because you go through what it was like getting first your older son diagnosed and then turning around and seeing that the younger son and the time that it took needed the diagnosis
and
as well.
Your younger son is much lower functioning than your older son.
Well, they're technically both higher functioning, and we're learning now, which will be shown in the second film, that Bakari is able to communicate via written words. He is in augmentative communication and typing sentences, typing words, and
so it
feeling pretty cocky about it.
Well, I think that's wonderful.
It's
you
really
should feel
a blessing.
cocky about that.
You know, something I haven't been, I don't know if I shared this with you, but the first film was nominated for an Africa Movie Academy Award.
That's great.
For Best Diaspora Documentary, yes.
Wonderful.
So it has been able to screen internationally, and it's just been translated into Tagalog to screen in the Philippines.
Wonderful.
Yes, so we are getting it out for people.
Okay.
Yeah.
Well, hopefully one day one of the big networks will do a series of all of them, and you'll get a deal.
I believe that will happen.
I do too.
I do too.
Not
hopefully,
but first
one
we've
day.
got to get this second
First,
one.
you got to get the second
one
done.
into the theaters.
Into the theaters.
Yes, and with the donations, I can get a translator hired to just start writing that script. I can pay for the editing. I can pay for the color correction and the sound mix.
Well, I love on your Indiegogo page, you have the whole budget there, so people can see what it is that you're asking for and how you're funding the parts of it that you're not asking for help with. It's all transparency, so people can see exactly where it's going. So we want to urge people, give a gift in somebody's name to be a part of something bigger than all of us.
It's going to change the future of autism. This is a film that is getting out to help people understand the examples of what our children are like.
Absolutely. But I'd also like to make a push for people, if you are part of an organization, that you're a part of a group of people that may have the screening and do a fundraiser for making of the second film.
Yeah, that's an excellent
That's what happened in New York. 3 weeks ago, and people donated generously.
Yeah, do a screening. Hold a screening. You'll get educated, and you can raise funds at the same time.
It's
a great idea.
Remarkable, good use of time.
Are we going to go to break before we say goodbye?
We don't really have time.
Oh, we
so
don't?
We're
Okay.
I want to thank you for donating in Wyatt's name.
You're welcome.
You are such a blessing.
Well, you know what? We love your message, and there's plenty to give to in this holiday season.
Yes, it is.
We all can be. We all can be blessed by giving to others. We all have learned it's so much more satisfying to give than to receive, and we get it back tenfold.
Oh yes, we do.
So going into the holidays now, you and I aren't going to be here for.
We're not here for the next 2 Wednesdays. Because next Wednesday is Christmas, and the one after that is New Year's Day.
Right.
But so we will be back on the 8th.
On the 8th. And Dr. Doreen will be back.
Dr. Doreen will be back. We'll be answering more questions about anxiety in the hour before.
Okay. And I'm going to go back and look at what I missed while I was driving over.
Oh, it's remarkable, remarkable show. And we thank you so much for being here.
Thank you.
Do we have 2 minutes left, Emily? We got a little bit more than that? We got 3 minutes left because I got a little bit of business I got to take care of here at the end. Want to remind everybody that the gift giveaway continues for 2 more days.
Great.
Make sure that you're watching and telling people about that.
Great.
Also want to let you know that tomorrow on the show we're having Representative L.E. here to talk about how to get our kids ready for college, for success at college, that will be really wonderful. Yes. And then in the second hour tomorrow we have Christina Adams with us tomorrow.
Oh,
she is
Christina.
she's wonderful. Author of A Real Boy. And, you know, life-changing for me when I read that book. Fabulous. It's the book that I give people when they have somebody diagnosed in the family. I say, start here.
Right.
Then there are more books later on. But Christina is now very active with camel milk. And that's a very exciting topic. So she's going to be here talking with us about camel milk. But she's also working to help that transition from being a teenager to adulthood.
Yeah,
and
her
finding
son
jobs
would be
as well.
getting close to that age now.
And so she's been very active in that. And a wonderful writer, writes for...
Great writer.
So many for Autism Media Channel and for Autism File magazine. So Christina's going to be with us here tomorrow. Then on Friday, we also have Hans Gillinger coming back for IEP tips. He was with us a couple of weeks ago.
Yes, I learned so much from him.
Wonderful attorney who used to sit on the other side of the table, now is representing parents, and he's got great IEP tips for us that we're really excited about. And then for our last hour of this show for the year 2013, Dr. Jonathan Tarbox will be here with us answering your questions.
Boy, has he helped me with a lot of issues in our household.
Oh my goodness, he is a miracle.
Yeah, Wyatt used to be up all night before Dr. Jonathan came over and just started working with us for a little bit.
Jem was punching me in the head until Dr. Tarbox came to our clinic and said, here's how we're going to take care of this. So he's amazing, great resource for research on how things work and why they work, and he'll be answering your question. And my favorite thing about him is that he puts it in language that we can all understand, instead of just giving us all the psychology speak, all the jargon that we try so hard to understand. So in any case, that's how the rest of this week is shaping up. Then we're off for a while. We'll be back on January 8th, and I cannot remember. I know we have a guest on the 8th, but I cannot remember who it is. Do you recall?
I just can't.
All right. Well, you know, we'll post about it. So in any case, as we leave, I think we have like 30 seconds left. I'm asking everybody, we got 1 minute. What's your hope for autism in 2014, Vena?
My hope is that the president comes on board and gets behind us and embraces all that we're doing and lets everybody know they need to get behind their local autism organizations.
From your mouth to God's ear. Nancy?
My hope is that we all come together as a community and become one powerful choir singing for this cause, be it the spectrum, that we recognize that we can work together and that there are people that desperately need help every step along the way, but that we come together as one united voice.
Wonderful. And we just got a message from Mike Hipple. He wants to make sure that I give you one of his books before you leave. So we will do that, Mike. That will happen.
And what about you? Your hope?
All the things that you guys have said, everybody that I've asked has said essentially the same thing, that we all come together, that we get some legislative help. So we're out of time. I'll see you tomorrow. Until then, give your kiddos a hug from me.
And give yourselves a hug from me.
Bye-bye.
Bye-bye.